Welcome back. Remember, channelstv.com has more news for you, and on youtube.com/channelsweb you can watch our videos. You can also watch us on your mobile device via your browser, or download the Channels TV app for Android, iOS and Windows devices from their respective stores. Besides giving you access to news updates on the go, the Channels TV and Channels 24 app have an eyewitness feature that you can use to share pictures, videos or news of happenings around you. Just install the app, then tap and swipe to reveal the menu and follow the instructions you find there. The Rivers State Governor, W.H.O, says the failure of private medical practitioners to service the 500 million naira non-interest loan given by the state government is making it difficult to start the second phase of the scheme. The governor raised the issue when the Nigerian Optometric Association, Rivers State, visited him at the government house in Port Harcourt. According to him, public hospitals in the state do not remit funds to the coffers of the government, and the state has to pay the salaries of all health workers.
We give a loan of 500 million naira. We are paying the interest. Every month, the bank deducts interest. So we're not worried. We said, look, one of the things that affects businessmen is the issue of interest in loan. The bank loan is so high, 22% and that. So sometimes when you check the principal and the interest, it's horrible. Before you finish paying the interest loan, it's a wahala. Out of the number of those that they have given this money, it's really disappointing. So I've taken the money, says they are right, after all, it's government money, this and that and this. So I can't believe it. I can't believe it that we can see that. And yet we complain of not getting the right support we're supposed to get. This is the first time in this state the government has come up to say, look, we're ready to assist. If you, defense badge, take this, and we show and we see signs that yes, they are doing well, we'll move on to the next phase and give them.
Governor of Rivers State, W.H.O. Now, today, April the 25th, is World Malaria Day, and the World Health Organization is worried about the slow pace of progress made so far by some countries in their efforts to end the scourge. According to the WHO, in 2016 alone, a staggering 194 million new cases of malaria were recorded in African countries, resulting in the deaths of over 400,000 people, including children. The WHO country director in Nigeria is, however, calling for an urgent need to make a strong case of political commitment to mobilize resources to end the epidemic.
On the 25th day of April every year, the world commemorates World Malaria Day to recognize global efforts to control the malaria epidemic.
On malaria and its
The country director of the World Health Organization holds a preliminary news conference in Abuja where he decries the slow pace of progress made by African countries in their effort to eliminate malaria. He calls on political leaders to urgently mobilize resources for the control of the disease.
14 countries with the world's biggest malaria problem are in the sub-Saharan Africa and account for 80% of the global burden. Many countries are not on track to achieve the targets of the Global Technical Strategy of Malaria 2016-2030. The pace of progress has slowed or stalled, with the significant gaps in the implementation of measures to prevent malaria. International and domestic funds for malaria prevention and control has stagnated.
In a similar vein, the Nigerian Defense Ministry held a malaria sensitization program for military officers and their families at the Mogadishu Barracks in Abuja. The Director General, Ministry of Defense Health Implementation Program highlights some of the efforts of the ministry to control malaria.
With respect to eliminating malaria among military personnel and civilians, the MOD Voltari program has equipped 2 laboratories for training of lab scientists on malaria microscopy. In collaboration with the United States President's Malaria Initiative, 350 civilian laboratory scientists from 13 states in Nigeria have benefited from malaria microbial training.
Although the pace of progress in the malaria elimination effort is slow, some progress has also been recorded. Between 2010 and 2016, estimated new cases of malaria dropped by 20% and death from malaria also declined by 37%. Countries in the African region also recorded the biggest rise in malaria testing from 36% in 2010 to 87% in 2016. Hence, health professionals are hopeful that with a little more push, malaria can be eliminated in the nearest future.
Well, let's get more on Nigeria's malaria status. Joining us from our Abuja studios is the Director, Malaria Control Program, Dr. Ernest W.H.O. Thanks for joining us on the program. Well, according to the World Health Organization, 3.4 billion people, that's globally, live in areas which are at risk of malaria transmission in 91 countries and territories. What exactly is Nigeria's status?
Well, Nigeria has a large contribution towards the number of those that have malaria. Of course, we know close to 25 to 30% of this burden that you mentioned now is contributed to by Nigeria. And it's not a good thing. I agree, yeah, we've made some successes, but we need to do more. Otherwise, we'll continue to be a big burden to the rest of the world. Nigeria actually takes a quarter or a little more than that of the whole burden of malaria.
Okay, Dr. W.H.O, if Nigeria accounts for about 25% based on statistics of this over 400,000 deaths, what's being done to lower that statistic? What's being done to reduce the statistics or the number of people who die, or to reduce Nigeria from having 24% of deaths recorded in Africa?
Yeah, a lot of things are being done. Nigeria's implementation of malaria control is really vast. We are doing a lot to promote long-lasting use of long-lasting insecticidal nets. I'm sure many people will attest to the fact that several states have had long-lasting insecticidal net campaign programs, whereby these nets are distributed to people all over the state. It's a statewide thing, campaign that has happened in several states. And treatment is being given out with artemisinin combination therapies. In the public sector, it's free. One of the things we are also emphasizing is the fact that because malaria is coming down now, when people go to the health facilities, they should be tested first before the treatment. And it's judging from the fact that malaria is coming down. And we have been making a lot of awareness, creating a lot of awareness, and also providing drugs for pregnant women to use intermittent preventive treatment of malaria in pregnancy. By science, we have also noted that when women are pregnant and by the second trimester, they attend the clinics and they are given sulfadoxine pyrimethamine, when they take it every month till they deliver, they have better pregnancy outcomes. So with these interventions that are available, of course, the issues of environmental management, which helps us to reduce the volume of malaria vectors, the breeding of malaria vectors in our environment. These are the things, the interventions that Nigeria is using, and a lot has gone into it. But all we are saying is that we need more to go into. We need from government at all levels. We also need from private sector. We need organizations that are working both in the communication, oil, and all that. People that are working within communities.
If I may come in here, Dr. W.H.O, if I may come in here, you are not just being the director for the malaria control program in the country. You have a lot of field experience. You see some of these things firsthand. How effective would you say these intervention programs have been?
Well, what we are saying is that, yeah, it's scientifically proven these interventions we are giving are effective. But what we are seeing is that people are not using them. When we distribute the nets to people, they don't use them. They just keep them And but it obviously shows that we need to do a lot of behavior change communication to be able to build the net use culture. And again, that's one of the emphasis we are making for this World Malaria Day, that we need a lot of behavior change communication, and private organizations, government at all levels can help to increase this, because if the people have the nets and they don't use them, obviously the intervention will not be working.
All right.
And then, of course, the issue of pregnant women.
Thank you very much.
Pregnant women attend these clinics.
Thank you, Dr. Nwokolo. Thank you. We get the point you're trying to make there. Thank you, Dr. Ernest Nwokolo, for joining us on the program. Well, when the program returns in a moment, we'll continue looking at more issues in the health sector. Join us again.